This is Sandy Tankers for TOS50.com, the other side of 50. And I'm here today speaking to Dr. Don David Lusterman once again. Good morning, Dr. Lusterman.
Good morning to you.
And Dr. Lusterman has been interviewed by us on several other occasions. And unfortunately, recently, he has not been well. Fortunately, for everyone who knows him and for him, he is now doing much better. And he's going to talk to us today about rehabilitation and rehabilitative medicine. And the interesting thing is, of course, for Dr. Lusterman, is that for once he was on the other side of the fence. Normally, he's the person helping people to rehabilitate, but this time he was the patient. So, Dr. Lusterman, why don't you tell us first what was wrong with you?
Well, I have a history of, I died when I was born, which is really the truth. My uncle, who was a physician at the hospital, when he saw the nurse, most nurses then were sisters, and she was on the floor praying when he came in after looking after my mother. And he said, the poor lad has gone. And he injected adrenaline into my heart, and I lived. But I lived with a lot of lung problems and heart problems at the beginning, which I thought I had finished with. Now at the age of 77 last year, we discovered that there was a heart problem. It was an electroconductive heart problem that's given me trouble because it was hard to diagnose. Had a 5.5-hour operation and a pacemaker ultimately, and it's been a tremendous help, but I wanted to really relearn how to use my body with this better heart-lung relationship. So I knew I needed that therapy. I have Parkinson's, which causes me to fall a great deal, and I wanted to work on that as well. So here I was doing 6 hours of physical therapy a week. I would go at Tuesday mornings at 8:30 and work for an hour, and then the same thing in the afternoon, a couple of hours every Tuesday and Thursday afternoon, one for physical and one for occupational therapy. In the course of those, I learned a great deal about an environment that was very beautiful. There is a physiatrist named Dr. Kupalang who heads this program. He's a remarkable guy. Physiatry is the aspect of medicine, is a fairly recent profession. Physiatrists work with the person who has suffered some kind of a disability or an illness that produces disability, and helps the person through looking at the person's whole being and how the illness or the problem affects it and what can be done to shift it. And he's created an environment interpersonally in which he does that very beautifully, and even more so, he has created an environment in which the staff does that. What I loved especially, this is, by the way, this is at South Nassau Community Hospital. I was very fortunate in the people who worked directly with me, but as I watched the staff, there was a beautiful chemistry between the staff and the patients. Patients come in sometimes filled with optimism and hope. Sometimes patients come in terribly scared, nothing will ever be better. And you see somebody come and they're in such despair they can't get through the first session. And you think, oh my goodness, will we ever see that person? Will they have the courage to come back? Often they do, probably because they go back and they speak with the physiatrist once again. But they come back, and little by little, we see it's as if the whole environment, all the people in the environment, the staff, the other patients, are pulling with that person. And it's an inspiration because we see the impact we each have as we develop hope that we can do as well as we can.
So you're saying that actually the people that you work with are the most important?
Absolutely. And they know that the people with whom they work, that is to say the patients like me, are the most important. So the synergy is beyond belief sometimes. And ironic, we almost never talk patients about what's wrong with them. We may talk about it, particularly with a piece of machinery we're trying to master and kid around about it. There's a lot of joking, but there's very little self-pity.
Mm-hmm.
But we know that when somebody comes in and they look sad and frightened, we know to be there, to be ready.
Well, that's very interesting, Dr. Lusterman. I'd like to talk to you about this a little further, but for today, at this moment, this is all the time that we have, and we'll continue this at a later date.
Thank you so much.